Hi, and welcome to our series on Human Anatomy and Physiology. This is the second video in our unit on Introductory Terminology. Before we get started on this video, I do want to mention that if you feel like you need some extra resources, we do have a shop linked in the description. It has things like fillable notes that follow along with our videos, as well as some practice worksheets. So if you're interested, go ahead and check that out. All right, so let's dive into our terminology. And so for this video, we're going to start off by going over some directional terminology. Okay, and with directional terms, they are typically used to talk about structures relative to another structure. And so by that I mean, like, you're comparing and saying, for example, this structure is closer to the front of the body than another structure, right? So that's what we mean by these terms are relative. So you're kind of comparing locations of different things. Okay, so let's go through our first terms. Right, we'll start off with some simple ones. And so these directional terms usually come in pairs, right? So pairs that have opposite meanings. And so we'll start off with the term superior. Okay, and so superior refers to a structure that is above another structure. And its counterpart term, inferior, refers to a structure that is below. Okay, so we have superior, which is above, inferior, that is below. So you could say that the nose is superior to the chin, meaning it's above the chin. All right, so let's move on to our next pair of terms. So if we come down here, right, we have our next pair of terms, anterior and posterior. So anterior refers to a structure that is towards the front or closer to the front of the body. Right? Another term for this is ventral. That means the same thing as anterior when we're talking about humans. And then we have our corresponding term, which is posterior. And so posterior means closer to the back, right, or towards the back of the body. And the term dorsal also would mean the same thing in humans, right, towards the back. Okay, so that gives us anterior, which is towards the front, right? Posterior, which is towards the back of the body. So you could say the belly button, right, is anterior to the vertebral column. Okay, so it's closer to the front of the body than the vertebral column. All right, so then our next pair of terms is going to be superficial and deep, right? And so superficial refers to a structure that is closer to the surface of the body than another structure, right? So superficial is closer to the surface, and then its corresponding term is deep. And so deep means further away from the surface, right? A more internal structure. All right, so that's superficial and deep. Superficial, closer to the surface, deep, away from the surface. And so it's important, with humans to keep in mind kind of the most superficial structure of the human body is going to be the skin, right? So the skin would be the most superficial, and then say, the muscles would be deep to the skin, right? So further away from the surface than the skin. Okay, so see how we're kind of comparing the locations of structures using these terms. All right, and so a kind of an exception to this relative nature of these terms, kind of comparing structures, is this pair of terms we're going to talk about here. Okay, so these are kind of like a special situation. All right, and so these terms, visceral and parietal, are used specifically to describe the locations of membranes in the body. Okay, so I'm going to kind of add that as a note to the top, right? That these are for describing the locations of membranes. Right, and so in a later video, we are going to discuss the body cavities and the membranes that line the body cavities. And so we will kind of use and apply these terms when we get to that section. All right, so but for now, let's just define them so we understand what they mean. And then when we get to that section, we can start kind of practicing them and using them. All right, so when we see the term visceral, visceral refers to a membrane that is sitting directly on the surface of the organ. All right, and so in our example here in this picture, we have a picture of one of the lungs. All right, and so the lungs have a membrane in the thoracic cavity called the pleura. Okay, so we'll learn about that in our next video. All right, but the pleura right here that is sitting directly on top of the lungs, right, that is the visceral pleura. So it sticks almost like plastic wrap, like cling film, right? It's sticking directly to the surface of the organ, okay? And so that is visceral, right? So visceral is kind of like the green line that's sitting on top of the lung there, okay? And then its corresponding term is parietal, right? And so parietal refers to the membrane that is lining and is attached to the cavity wall. All right, and so then to go back to our example here with our lung, right? So you have the lung, it is sitting in the thoracic cavity. You have your visceral pleura sitting on top of the lung here. And so our parietal pleura would be this blue line right here, and it would be attached to the wall of the thoracic cavity and also along the diaphragm here on the bottom. Okay, and so you can see there's a little bit of space here in between the visceral and parietal, and we'll talk about that, in the next video and also in future chapters. Or usually there's some fluid and stuff like that in that space. Okay, but you have visceral on top of the organ, and you have parietal attached to the cavity wall like this. Okay, and usually the visceral and the parietal are a continuous membrane, and you can kind of see that here, right? So we have our visceral on top of the lung, and then it continues right into that parietal that lines the cavity wall, okay? All right, so visceral and parietal specifically for when we are talking about membranes. All right, so let's move on to our next set of directional terms, okay? All right, so right here we have our two final pairs of directional terms, okay? So let's start on the top, right? So we have medial and lateral, okay? So these are paired, all right? And so medial refers to a structure that is closer to the midline of the body. So midline refers to, if you draw a little line right down the middle of the body, dividing it into left and right, that's midline, okay? So medial would be closer to that middle point, that line going down the middle, all right? And its corresponding term is going to be lateral, right? And so lateral means further away from the midline of the body. Okay, so medial meaning closer to midline, lateral meaning further away from midline. All right, so you could say that looking up here at the face, right, you could say that the eyes are medial to the ears, right? So the eyes are closer to midline than the ears. Okay, so that would be one example. All right. So then our next pair of terms are going to be proximal and distal. Okay, and so proximal and distal are terms that can be a little bit confusing because they're extremely specific in how you use them. Okay, and so proximal and distal are used exclusively when we are talking about structures that are present on the limbs. All right, so they're used for the limbs, and so limbs referring to the arms and the legs. Okay, and so our first term we're going to define is proximal. And so proximal refers to a structure that is closer to the point of attachment or closer to the torso. Okay, and so when we are talking about the torso or the point of attachment, I think it helps to kind of define that and what it means, just in case you're not familiar. All right, so if we're talking about the torso, we basically mean like the trunk of the body, right? So this kind of rectangle here, okay? And so the torso is kind of the middle core of the body, and then you have the neck coming off of the top of it, the arms coming off the top parts of the sides here, and then the legs coming off of the bottom, right? So that's the torso, right? Or if we're saying like the point of attachment, we just mean, like where the legs attach here, right? Or if we're talking about the arms, where the arms attach here. Okay, so proximal would just be closer to that point of attachment or closer to the torso. All right. And then the corresponding term is going to be distal. And so distal just means the opposite, right? So it means further away from the point of attachment or further away from the torso. Okay, so again, to review, right, proximal would mean closer to the point of attachment, so for the leg here, right, and distal would be further away from the point of attachment here. All right, and so an example of this would be, let's say we're talking about where the knee is relative to the ankle, okay? And so you would say that the knee is proximal to the ankle, meaning the knee is closer to the point of attachment than the ankle. Okay, and so then one kind of, I think, common misunderstanding and kind of question that comes in relation to these two terms, so proximal and distal, is, well, why wouldn't you be able to say that the knee is superior to the ankle, right? And so looking at this picture and in anatomical position, that would be true. However, what is unique about the limbs and why the limbs get this special pair of terms is because the limbs are so mobile, all right? So you could say that the elbow is superior to the wrist, right? So the elbow from this picture looks superior. It is above the wrist. However, what is unique about the limbs is that they are extremely mobile, okay? And so you can take your hand and you can lift it straight up above your head, and that would now make the wrist superior to the elbow, all right? However, it never changes how close those structures or far away they are from the trunk of the body, right? Okay, so no matter where you position your arm, if you hold it straight up or if you have it down at your side, right, the elbow is always going to be closer to the trunk of the body than the wrist, right? So the elbow is going to be proximal to the wrist. So that's why they have these special terms, okay, for the limbs, the arms, and the legs. Because those are such mobile kind of parts of the body, with these very mobile joints, right, allowing a lot of movement. Okay. All right. So now that we have gone through all of our directional terms, let's do some practice questions using them. Okay, and I'll kind of walk you through, if you're on an exam, kind of how I like to approach answering these questions, if they make you nervous or anything like that. And so it is important for these types of questions when you're in an exam situation that you know your regional terms that we went over in our last video. So make sure you're reviewing those, make flashcards, whatever helps you practice, labeling a picture like this. That always helped me. All right, and so you need to actually know the terms that are being mentioned in the question in addition to these directional terms. Okay, so let's go through these. All right, so the first question is the ocular region is blank to the otic region. Okay, and we actually talked about this a minute ago. All right, so the ocular region, remember, ocular means eye. Right, so this is kind of the first thing I would do. I would do it in my head, or you can write it down either way, right, on a test. So I'd say, okay, well, ocular means eye. Otic refers to the ear. All right, and so if you're visualizing kind of the human body in your head, you can visualize, the eye is here, the ear is here. All right, and so what does it look like? Okay, so the eye is, you could say, looking at this picture, the eye is medial. Right, so it's closer to midline than the ear. Right, that would be correct. Okay, however, if you're also kind of envisioning the body from our previous angle, right, so if we look at it kind of from here, you could be correct in also saying that the eye is anterior, right, so it's closer to the front than the ear. Okay, so more than one correct answer, right, so as long as it makes sense, right, you can describe both of those directions. So you can say the eye is medial to the ear, or you can say that the eye is anterior to the ear. All right, let's look at our next question. Okay, so the next question, the sternal region is blank to the umbilical region. Okay, so first we'll define our terms. All right, so the sternal region is the breastbone, right, in the middle of the chest. That's the sternal region, and the umbilical region is the belly button. Okay, so right in the middle of the abdomen. All right, so if we kind of visualize where those structures are, we have the sternal region here, right? We have the umbilical region here. And so you can kind of, by looking at this, visualize and say that, well, the sternal region is above the belly button, right? And our word for above is superior. So the sternal region is superior to the belly button. So if it helps you to use kind of common terminology to start with, and then you can apply our fancy anatomy words to it, that's kind of one way to do it, right? So the sternal region's above the belly button, and then our fancy word for that is superior. Okay? All right, and then our next question. The liver is blank to the skin. Okay, well, the liver, we know, you may not know exactly where it is, but you know it's an internal organ. All right, so it's kind of somewhere on the inside of your body in your abdominal cavity, right? You know the skin is covering all over the outside of the body, so we know those things. And so this would be deep, right? So the liver is deep to the skin, right? It's more internal than the skin. Okay. All right, and then our last question, practice question here, the patellar region is blank to the femoral region. So first we will define our terms. Okay, so the patellar region, that refers to the kneecap, right, the front part of your knee. And then the femoral region refers to your thigh, right, so the upper part of your leg. Okay, and so if we're looking here on our picture, right, we have our patellar region here, and we have our femoral region here. Okay, and so both of these structures are on the leg, right, on one of the limbs. So we are going to use our special term for the limbs. Okay, so we would say that the patellar region is distal to the femoral region, right? It is further away from the point of attachment or the trunk of the body than the thigh, okay? So it is distal. And another thing I want to point out to you guys in this video that I see a lot on tests with my students is that you need to pay close attention to the order that these terms come in, okay? So it does matter that they say patellar first and then femoral, all right? So you're comparing where the patellar region is to the femoral region, right? So the patellar region is distal to the femoral region, okay? Because if I switched that, if instead this question said the femoral region is blank to the patellar region, right? So the femoral region is blank to the patellar region, it's actually going to be the opposite term, all right? Because we put them in the opposite order. So we would say the femoral region is proximal. It's closer to the trunk than the patellar region. So make sure you are paying attention to the order of those structures. You don't just, find where the structures are and pick a term that describes, whatever you think. Make sure you pay attention to the question, okay? All right, and then our last section for this video is going to be on sectional planes, okay? And so these sectional planes, and then some kind of additional kind of directional terminology, right? Sectional planes are going to be dividing the body, kind of cutting it into different sections. And so with each of these, we'll define it, and then I can give you kind of a clinical example as to why this is practical and important, okay? All right, so our first sectional plane is called a transverse or cross section. And a transverse section is going to divide the body into top and bottom parts, or if we're going to use our new fancy directional terms, it's going to divide the body into superior and inferior parts, right? So top and bottom, or superior and inferior. All right, and so an example for this would be, so you can see, right, we've cut our pineapple here, right, into kind of top and bottom parts. But a practical example with the human body would be like a CT scan, right? So if you get a CT scan, specifically if you wanted to say, look at the vertebral discs, maybe you were looking for like a herniated disc or something, right? So you do a CT scan of the spinal column, right? And so that way you can get a cross section through the spinal column at each of those discs to see if, one of the discs was herniated and bulging outward. Okay, so with CT scans, you can do them from many different directions. So technically, you could do a CT scan for all of these different sectional planes. All right. But an example of how you would do or why you would do a CT scan that is a transverse section, that could be one of them, right? To look at those discs and see if it's herniated. Okay. All right. And so our next type of sectional plane is called a sagittal section. Right, so a sagittal section is a section that divides the body into right and left parts. Okay, so it divides into left and right. All right, and if we are going to be more specific, right, you can also talk about the term mid-sagittal. Okay, and so mid-sagittal refers to a section that is precisely down the midline of the body, giving you like exact left and right halves. Okay, so that's how mid-sagittal, right, is a little more specific than just sagittal. And if you are referring to any other kind of sagittal section that is not precisely mid-sagittal, you can also use the term parasagittal, right? So that would be a sagittal section that is not down midline, all right? But kind of you usually say kind of sagittal section, and if you're being more specific, mid-sagittal is right down midline, okay? Right, and so our next sectional term here is going to be a frontal or a coronal section, right? So a frontal or coronal section is going to divide the body into front and back, right? So that's kind of how I remember it, right? A frontal section gives you the front versus the back. And so using our fancy terms, it'll divide into anterior and posterior parts. Okay, and so some examples for our previous section and this one. So first for a sagittal, right, or mid-sagittal section, a lot of times these can be used like a mid-sagittal section, right, can be used when you're doing like an MRI of the brain, okay, and you want to look kind of mid-sagittal at a section of the brain to maybe look at some structures we'll talk about later, like the corpus callosum, right? Some of these structures that are on midline, right? You can examine that with a mid-sagittal section. Okay, and then a very common example of the frontal or coronal section is if you go to the doctor and you get, say, a chest x-ray, right? You will be standing, in front of the x-ray screen, and they'll do a chest x-ray. That's kind of like looking at a frontal section, right? So you're seeing the inside of the body from the front, all right? You're seeing the heart and the lungs, right, from an anterior view, okay? All right, so that is a frontal or coronal section. All right, and so our final three terms here we're going to define. So I'll define them, and then I'll kind of give you some examples of how they can be used. Okay, and so our first term here is ipsilateral. Ipsilateral means that two things, right, are on the same side of the body, right? So they're on the left side of the body together, or the right side together, or even in an organ, right? So they're on, the left side of the liver together, or the right side of the liver together, right? So the same side. Okay, but another example we'll actually be using later on in this series on anatomy and physiology is going to be with reflexes, right? And so if you think about reflexes, one of the classic ones is the pain reflex, right? So if you reach out your left hand and you touch a hot stove, right, and that is going to be very painful, the reflex is going to be to pull your left hand away from that hot stove, okay? So with that reflex, the stimulus, the pain from the heat, right, and the response, pulling your hand away, both occur in your left hand, okay? So it is an ipsilateral reflex, right? The stimulus and the response are on the same side of the body, right? So on the same side. Okay, so then our next term is going to be contralateral, okay? And contralateral refers to things that are on the opposite sides of the body. Okay, and so one example we will get into when we talk about the nervous system and the brain is kind of motor control, okay? And so when we talk about the brain and voluntary motor control, so, you can think about moving your arm and it moves, that is contralateral, Okay, so movement of your left arm is controlled by the right side of your brain, right? So it's on the opposite side. So the left arm is controlled by the contralateral side of the brain, meaning the right side of the brain. Okay, so that's contralateral. And then finally, we have our last term, which is bilateral. All right, and so bilateral means that these things, right, events or structures are on both sides of the body. Okay, and so an example of how this could be used, you could say, let's say there's a patient and they have swelling in both of their legs, right? So swelling is referred to as edema. Okay, so you would say that they have bilateral edema of the legs, right? So you're saying that they have edema in the legs that is on both sides, right? It's bilateral, it's both sides. All right, and so that wraps up this video and our terminology. We have a couple more videos in this unit on introductory terminology. We'll be going over the body cavities and the membranes and also some of the organ systems. So stay tuned for those videos. If you have found this helpful, please subscribe and like this video. That'll help us get to more students and help them. And again, if you're interested in any resources, check out our shop in the description, and I will see you guys next time. Bye!